Hello, everyone. My name is Cassie Bush, and I am the Chief of Policy and Training Section in the Provider Enrollment Division at the Department of Healthcare Services. I am joined by Erica Holmes, Division Director of Benefits. Thank you for joining us at today's stakeholder meeting. Today, we will be discussing the Regulatory Provider Bulletin titled Updated Medi-Cal Established Place of Business Enrollment Requirements and Procedures for Licensed Midwives and Certified Nurse Midwives. The purpose of today's hearing is to go over the draft provider bulletin and provide you with an opportunity for discussion of the provider bulletin. For our agenda today, we will provide a bulletin overview and then we will go over the draft provider bulletin in more detail. Lastly, we will end with comments and questions. Before we begin, I have a few quick reminders. If you are experiencing any technical issues, please send an email to dhcspedstakeholder@dhcs.ca.gov for help. Please hold all comments and questions until the end of the presentation. We will have plenty of time for comments and questions at the end. Please be sure to send any questions or comments made in the chat box to everyone. Comments not shared during this hearing can be sent to dhcspedstakeholder@dhcs.ca.gov. Only written comments received by email by 5 p.m. today will be considered prior to publication of the final bulletin. This hearing will be recorded and posted on our stakeholder hearing information webpage for future reference at a later date. We will provide a link to that webpage in the chat. Today, we will be going over the draft provider bulletin titled Updated Medi-Cal Established Place of Business Enrollment Requirements and Procedures for Licensed Midwives and Certified Nurse Midwives. In accordance with Welfare and Institutions, W&I Code Section 14043.75B, the DHCS Director is updating the requirements for licensed midwife (LM) and certified nurse midwives (CNMs) providers who apply for enrollment in the Medi-Cal program to be reimbursed for the covered services they provide to Medi-Cal members. As a reminder, a copy of the draft provider bulletin was attached in the stakeholder hearing invitation email that was sent on July 18, 2024. We will also provide a link to the draft provider bulletin in the chat now for reference. And now we will go to Alex, who will review the draft provider bulletin in more detail.
Good morning, everyone. My name is Alex Hernandez, and I'm an analyst in the policy unit in the Provider Enrollment Division. Effective September 17, 2024, individual LM and CNM providers may report an administrative location as their service address, and that administrative location will be exempt from certain established place of business requirements listed in California Code of Regulations, Title 22, Sections 51,000.60C9 and 51,000.30F2. In the next two slides, we'll go over the definition of an administrative location for the purposes of this bulletin. LM and CNM providers may use an administrative location for purposes of reporting a business address in the provider application and validation for enrollment electronic application. An administrative location is defined as the physical location associated with the operations of LM and CNM providers. The administrative location is only where services are dispatched or based. However, no in-person services are provided to Medi-Cal members at the administrative location. The administrative location address may be the same as the listed mailing address. However, it could not be a post office box, virtual office, or mailbox, or any other address that is used for mail delivery only. This address will appear in public directories, including but not limited to the California Health and Human Services Open Data Portal. Medi-Cal program requirements. LM and CNM providers must meet Medi-Cal provider enrollment requirements and standards. Medi-Cal enrollment standards require applicants to abide by all state and local laws and ordinances pursuant to CCR Title 22, Section 51,000.30E, 51,000.30F1, and F3. These requirements and standards include, but are not limited to, obtaining a business license as required by the city or county where the applicant is doing business, obtaining a fictitious business name statement from the county when required by state law, obtaining and maintaining workers' compensation insurance when required by state law, and finally, obtaining and maintaining professional liability insurance. This bulletin exempts the following EPOB requirements. Under CCR Title 22, Section 51,000.60C9, LM and CNM providers are exempt from certain EPOB requirements. The waive requirements are regular and permanently posted business hours, is identifiable as a medical/healthcare provider or business by permanently attached signage that identifies the name of the provider or business as shown on the application, obtains and maintains comprehensive general liability insurance coverage under CCR Title 22, Section 51,000.30 F2, LM and CNM providers are exempt from comprehensive general liability insurance requirement. This bulletin modifies the requirement set forth in CCR Title 22, Section 51,000.4, which permits the use of a cellular telephone as the primary business phone for LM and CNM providers. In order to waive the EPOB requirements that were mentioned on slide 9 and as outlined in this provider bulletin, the individual LM or CNM provider must complete and submit an application for their appropriate provider type through PAVE and attach an attestation to their application. The individual LM or CNM provider will need to upload the signed attestation to the general liability insurance field in lieu of a copy of a general liability insurance policy. The attestation can be found on page 3 of the provider bulletin. Please note that this bulletin is not applicable to LM and CNM providers providing in-person services at their administrative location or at any other location that is either leased or owned by the LM or CNM provider. The location where the LM and CNM providers are providing in-person services is not exempt from any EPOB requirements outlined in this bulletin. Instead, that location must meet all EPOB requirements. And now I'll pass it back to Cassie for comments and questions portion of this hearing.
Thank you, Alex. Thank you all for listening to our presentation about the updated Medi-Cal established place of business enrollment requirements and procedures for licensed midwives and certified nurse midwives. If you would like to share a comment or ask a question, you may either raise your virtual hand or type it in the chat box. Please send any comments or questions made in the chat box to everyone. We will go through the chat box first. Then, if you have your virtual hand raised, we will unmute you individually so you can ask your question verbally. If there are any questions that are not answered during this hearing, please note that we will be addressing those questions along with other questions submitted to us in the chat box or by email in a questions and answers document that will be posted to our website at a later date. With that said, I will start filtering through the chat box. Susan Meyer is asking, are we able to receive a copy of this presentation after it's over? So yes, you will be able to receive a copy of this presentation and including a YouTube video that will also be posted at a later date, and anything specific to any questions you might have, please feel free to email us at dhcspedstakeholder@dhcs.ca.gov, and we will make sure we respond in a timely manner. Um, Terry Thomas asks, will we get a copy of these slides? There will be a slide deck available for future reference that will be posted to our website at a later date. Those are all the comments for DHCS. I'm going to defer to Erica Holmes, Benefits Division Chief, who will answer questions in the chat box. Erica.
Thank you. I'm just looking really quick to see what questions have been asked. There is a question that I'm not 100% sure about. We can take it back and discuss. The question was, do we need to enroll these providers as fee-for-service or ORP? That's ordering, rendering, some PPED can keep me honest, ordering, rendering, and referring providers or something like that. Go ahead.
Yes, ordering, referring, prescribing.
I think that was the one. The commenter says we are only billing their services as fee for service and not group billing. So I don't know if that's a question PED can answer, if we should take that back.
Yeah, and it's a question from May Wang. So May, we will definitely connect with you through email and answer your question separately so that we might be able to provide more detail.
And apologies, I just realized my camera wasn't on. There's a second comment in the chat from Shadman, and it looks like the question is, it was mentioned that in-person care is not exempt from this bulletin. So I can start, and then if PED wants to jump in as well, that's fine. So that's correct. So this location is a place where you are not providing direct patient care or services. This is an administrative location. So if you are providing direct patient care, it would not be exempt under this bulletin authority. PED, please weigh in if there's additional information.
We concur with that response. And if there's additional questions you might have, please feel free to email us at dhcspedstakeholder@dhcs.ca.gov. All right. I also see from Susan Meyer, could you please provide the email address we need to send our request for a copy of this presentation in the chat? More than happy to. The email is dhcspedstakeholder@dhcs.ca.gov, and we will have Elisa from our team send you that email link. Right. I don't see any more questions in the chat, so now we will move forward with verbal questions. So if anyone has questions, please raise your virtual hand and you will be unmuted to be able to ask your question.
Hi, Cassie, it's Paul. I do not see any raised hand at the moment.
All right.
Oh, I take that back. One right here. 1 second. I believe it's from Sue. And I'm sorry if I mispronounced your name. I just unmuted you.
Sue, you are more than welcome to ask your question.
I believe you will need to unmute on your end. I've accepted your request.
Okay, I wanted to see, can we ask questions about the PAVE enrollment?
Yes, we can certainly ask questions about PAVE enrollment. For any PAVE related items, I'm going to defer to Misty Chittick, who is a branch chief at the Department of Healthcare Services. So Misty, if you could hop on and feel free to answer any questions that you might have related to PAVE.
Okay, and the question I have is when we put the provider's medical number, PAVE used to verify it for us, and it would autofill the fields, and for some reason it stopped, and it was really, really helpful for us. Will that come back, or is going to be eliminated for permanently?
Hi, Sue. So that information I think you're asking about has to do with the NPI number that you enter, and then it pulls the information from NPES, correct?
No. Right when we put the information for that section where we put their medical, their DEA, their home address, usually it populates. So a while ago, the medical ID would populate, and it would give us actually a screen of their medical ID, and it stopped all of a sudden.
Okay, if we can take that offline, and if you don't mind sending that information, or Cassie or team grabbing that, we'd be more than happy to work with you and seeing what issues you're having. Because if it's not auto-populating, we would want to get that corrected for you. Because no, that's not the intent. We do realize those features are very helpful, and we want to make the process as easy as possible. So we'll work with you in getting that information.
Perfect. And you're still not accepting the breeze printout from the website, or that is acceptable now?
We can follow that back up
Okay.
online with that as well.
All right then. Okay, thank you. Thanks.
You're welcome.
You're welcome, Sue. And Sue, I also put our email address that you may email those questions to us, and we would be more than happy to answer them for you.
The stakeholder one? Okay, I'll write it down.
Correct.
Okay, perfect. Thank you.
Thank you. All right. Any additional questions?
Cassie, I don't see any at this moment. No other questions.
Excellent. Thank you. So as mentioned earlier, if there are any additional questions that were either not answered during this hearing or in the chat, please note that we will be addressing those questions submitted to us in the chat box, or again by email in a question and answer document that will be posted to our website at a later date. As a reminder, any comments or questions not shared during the hearing can be sent via email. All comments, feedback, and questions must be sent to DHCSPED stakeholder@dhcs.ca.gov and received by 5:00 p.m. today for consideration for the final version. Please make sure you reference your name, organization, if you're affiliated with one, and the provider bulletin title in your email. Thank you again for your attendance and for your participation. This hearing is now adjourned.